Okay, I've drained my toddler bladder.
Oh my God.
We're talking about treatment and
the religious
religious
aspect of
aspect.
things. So that does seem to be something that's tough, but I feel like with like LADC and CDC folks is they don't seem to have to adhere to the religious stuff as much. But do you hear a lot of that when it comes to these, treatment facilities or treatment groups?
Yeah, so like a lot of treatment work, there's the word God in there somewhere, and it's kind of like, well, what about when people don't believe in God? And then they just refer to it as like a higher power, which could be anything. And I don't really personally get like into that really, because I'm not an atheist, but like I don't believe in God.
Sure.
So it's really hard for me to get behind. Like, if that's what you believe in, that's working for you, and whatever. But the problem I think I saw in treatment was that other clients would kind of be like, well, why don't you? And kind of like shove it down your throat. And it's kind of like, I'm not gonna be over here and be like, God doesn't exist. I'm not gonna do that to you. So it's like why don't you respect the other person?
Yeah.
Have a nice day. Nothing happens when you die.
Oh my God.
So Chris
Stuff
would get
like
it, because
that.
I think you said there wasn't very many atheists when you went.
No, there was one. There was one other person that I met. But there's all of these books that you read on a daily basis. Every morning starts out with what they call morning meditation. And there was 6 or 7 books, and one of them has like, I don't know, 2 or 3 pages, and well, the book doesn't have 2 or 3, but 2 or 3 pages about how we're not lost. And the phrasing was, are we lost like the atheist never to be found? No. And because it's a call and response book, everyone in the group has to say no. And it's like, oh, cool. Everybody unanimously just fucking canceled me out. And I personally, like, because I wanted to be successful so much, I tried to look for meaning in different ways. And so my higher power, I don't even like calling it higher power, but I just said my reason for sobriety is purpose. And purpose can be any number of things. If it just means that I have a steady job or I have a place to live, like it can be really minute things and mundane things. And having those things, what does it require to have those things? It just gets you to start to answer these like basic questions, because sobriety doesn't have to be this like the pearly gates opening in this incredibly profound thing. Really, what you want is a normal thing, so that your day to day feels manageable. That's super important. But when people say like, I'm praying for you, the way that I changed it was, what they're really saying is, I hope that whatever you need, so like let's say a cancer patient, I hope that there are medical advances available to you that will help you get through this.
Right.
And when I started to do that, it's not discounting, it's just making sense of, like, because people struggle when they hear that, like, I'm praying for you, that it's like they're washing their hands of the situation, when really they actually do care deeply, and they just don't know how to vocalize. They don't know how to say, I hope that dialysis works and all that shit. Like, they're just saying, I hope that whatever is needed is available to you. And so those were big things for me that helped me start to get through treatment, was that, like, it's not what those people actually want. They don't actually want me to have God. I mean, there were people that wanted me to have God in my life, but what they really wanted was for me to just be successful.
Right.
But that is tough, and it sucks now that really what you need is distraction from destruction. That's what treatment is. You're going in there and they're taking your mind off the substance. And they're saying, okay, so what do you do Monday through Friday? How can we get back to what you were doing Monday through Friday?
Mm-hmm.
And finding these things to distract you from how badly your brain wants you to go right back to that thing. Which, yeah, I classified as distraction from destruction. I'm going to trademark it and start putting it on shirts.
Perfect. Print me one.
But yeah, the religious thing. So when you're going through school and learning these things, was there a religious aspect to that as well? No. See, and that's what I think is really interesting. Like, why is it that when you're going through school, they recognize that you don't need God in the classroom
I don't know.
to help people, but as soon as you get out, for some reason, it has to come with this other thing.
In mental health, we don't talk about God.
I mean,
but then I feel it's so odd that with chemical dependency, that's
like, higher power or God or what have you. But it's very much, I think, putting it on, like being able to put it on somebody else, being like, you got this type of situation. I mean, there's like different levels, of course, where people are like, they come out of treatment, which if it works for them, that go ahead. Like, that's awesome. That they like preach, like God has done this, this, and this, and this. And I mean, again, if that works for you, that's amazing. But, you did that. Like, you put in the work. You have my stomach. I'm sorry. Like, you put in the work. And I mean, if that's what helps you get through it, that's amazing. Like, you have to like find your driving force for like being sober and like reaching those goals. You know what I mean? And
that's a great way of putting it. What's your driving force?
Right. And it can't be, I see a lot of people say my family. That's a good one, but it's got to be more self-centered than that, I think. Because it can't just be your family, unfortunately. Yeah. I mean, that sounds maybe selfish, but it's true. Like, what are your personal goals?
Yeah. Well, because a lot of them you're forgetting, like when they say family, they're forgetting that family wasn't enough before.
No,
so there's got to be something more to that.
Right. So it's just, and like a lot of people don't even, because they've been using substances for however long, they don't even know who they are anymore. So you see like a lot of like self-discoveries, and I mean, I hate to say it, but like I love seeing the breakdowns.
Yeah. Because
that's when, like, usually everybody comes in like, yeah, I got this, blah, I'm gonna do these steps or whatever, and but when you get to see them like just break down and cry like babies, it's just like, oof, we got them, like, know, because I feel like after that, like, they've got like a release and they're more open, and it also depends like why they're there too. I mean, if it's court ordered and this is like their 15th treatment center and they're doing it because they don't really want to, but it's better than jail type of situation. Yeah. It just, it's so dependent, but I do like seeing the breakdowns.
Yeah.
So it's really.
You want to pull that guy a little closer to you again? Sorry.
My buddy.
There we go. Another thing that like I learned, or that I saw, I should say, was, especially with men, was they didn't want us consoling them in group. They didn't want us to like rub their back or hand them a tissue or anything, because for a lot of them, this is the first time that they're opening up about anything.
Right.
So we need them to see, like, recognize the weight that it's having on them right now, and then how do we not fix it, but how do we cope with the emotions that they're feeling right now, so that they can use that as an empowering thing rather than this crippling thing.
Right. And with men, it's because my first internship I worked with mostly men. Men versus women, it's so different, because for women it's just more socially acceptable for us to cry, even though I hate crying, I'll be honest, but especially in public.
Well, that's tough, because at the end of this we're all supposed to cry, so
All right. Okay. Well, did my makeup. Dang it. But women, it's so like more socially acceptable for us to cry. For men, it's not. So like I think that it's normal for them to be like angry versus like us like, well, why are you angry? Like, I mean, and I show like, I mean, I swear like a sailor, it's fine. But with men, I think that being like compassionate and like letting them know it is okay to cry, like normalizing that for them again is going to be really important. You're not going to want to say like anything that's, like even if you're kidding later, like I mean not as a like as a counselor, but even like other
anything
clients.
that discounts their emotions.
Yeah, like I mean I have heard people be like kind of making fun of them about it later, and it's like, no, do not, like, because then that builds that wall back up.
Yeah,
it makes them feel like it's not okay, and it's totally okay. So I mean,
yeah, I mean, it was surprising. I mean, and you could tell that age made a difference in the people that would get choked up. Well, and upbringing too. It was just because they were perceived as manly and like strong and all of these things, that they're never supposed to show emotion. And so when they saw somebody show emotion, the types of questions that they would ask would be like so having nothing to do with, okay, I'm sorry, I'm not explaining like, so story time.
You're okay. Going... I'm going to have a question about this in a second.
Yeah, I was going to say, just when I'm talking about this, I'm saying, so in treatment, you would have to tell your story.
Yep, your like life story.
Afterwards, people can ask you questions. So somebody would get emotional during their thing, and an example of like how uncomfortable somebody would be, they would ask a question like, what position did you play in football in high school? And it's like, oh yeah, I did this. And it's like, you're showcasing that you felt uncomfortable, and you just wanted to distract them from that and get away from it because you feel uncomfortable. Mm-hmm. And others like myself that were like more emotionally in tune, like we would ask things like I would ask all the time, have you ever been in therapy? Has anyone ever talked to you about trauma or PTSD or anything like that? And one person was like, yeah, I've been to therapy once. But beyond that, everybody else was like, no, I never even thought about that. And yeah, I love being a giant baby. I'm an emotional baby.
That's okay though. That's cute.
Well, it's important, like, because like you were saying, like I swear all the time. I say really weird shit nonstop, but that doesn't mean that I'm devoid of being emotional and being able to take someone seriously when they're hurting.
Right. Like, I mean, I don't know if you use these as like coping or defense mechanisms, but I use like, I swear, obviously, and then I use humor. Mm-hmm. I'm like really sarcastic and like funny, but really I'm probably being serious about whatever it is. Yeah. You know what I mean? Which is like a good way to deal with it, but sometimes people don't know you're actually being serious, Right. Yeah. I mean, with my therapist, I'm like obviously really real, but I don't know if you do that. Do you do that? Like with humor? Yeah.
Yeah, for sure. Well, I mean, there was before it was a lot of deflecting.
Yeah, I was going to say deflecting.
Yeah. But now I do like, I don't know if you want to call it like anti-deflecting or like meta-deflecting. Like basically I make jokes to let somebody know that like you're in a safe place. You know what I mean? So like when I've been messing around here, it's like to let you know that like we're all on the same wavelength. But before, I would use it as a way to make someone think that everything's fine, and then that night I would drink like crazy and cry and all of this shit and like not be owning up to putting up a facade because we're like Kim and I for the last 13 years have been viewed as the happy people, the funny people, the extroverted, all of these things that historically are like what really happy, well put together people are. And
or they appear to be.
Yeah, appear to be.
I was gonna say, like, I similarly, I mean, I've got people I went to high school or friends with that like didn't know anything about what my home life was like, and they thought that I was super happy. They thought that my life was perfect, and I was like, well, of course you did. That's what I projected, and that's what I wanted you to believe.
Yeah.
Yeah.
I mean, I don't really do that anymore. I mean, I can if it calls for it, but like I don't. How much energy that takes? It takes a lot of energy.
You know, that's interesting. Have you gotten better at picking up when someone is deflecting? Like when you're assessing people?
I guess, yeah.
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 You recognize it more? Like,
Yeah.
can you tell when I'm deflecting?
Yeah. I've known you forever, so that's not, yeah.
That's just interesting. I've never thought about when I would deflect when I'm talking to you, how you perceive that. Like when I was going through addiction and stuff and like not admitting to things, would you, like, how often were you seeing me trying to change the subject or get away from?
All the time.
What did that look like?
Well, I didn't like you then, so.
That's fair.
Yeah.
Well, I mean, is that tough? Like, so that's kind of what I'm getting to is, on a professional level, you see that there's...
Well, I don't get angry because they're using it as a defense mechanism.
Right.
So I don't get angry at my patients. I live with you. I look at you a little differently, so I would get angry at you.
Yeah.
But I noticed that your people use it as a defense.
Yeah, like it's definitely a defense mechanism to protect you. But like with my clients, I call them out.
Yeah.
You're like, you're deflecting. I was like, lay the shit out. Like, let's go.
Yeah.
Like, I mean, obviously that's not like the first meeting, but
Yeah.
you know,
Yeah.
I mean, you have to be blunt. Like I'm like that with people in my personal life too, like friends and stuff. Be like lay it out. Let's go.
Yeah.
Yeah.
You know, like what's bugging you? Because
I've started to do that for sure, especially in the last like month or so, where like, so they'll start to open up about a thing and I'll go, I've had 2 suicide attempts. I may have bipolar disorder. I have blah, 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 blah. I go through the thing and I go, now it's your turn. And like a lot of times they don't want to admit to any of the things. And it's like, if you think that I'm here to help you, recognize my shit, right? And if you think that that is going to be of value in your situation, then you got to let me know what you're dealing with too. Because I don't know what aspect of me that you're wanting me to divulge more of so that I can help you. Like, what is it about what I've been through that you think is going to help you? So tell me, let me in on the things so that then I can, yeah, sure. If I've been through that, then I can tell you my real world experience version of that and then suggest what you should do on a professional level.
that makes sense. Yeah. I mean, even like people that aren't clients, like friends or like, you know, romantic relationships. I find that like people are so blocked off. It doesn't matter. Like you could know them for like 6 months, and sometimes you'll just never like. It's more of a one-sided relationship, unfortunately, and they're like I personally can't do that. I can't do that with personal relationships because then it feels like, well, they hold power because they know so much about me and I know like barely anything.
And I've had friendships like that in the past, and where it's like I'm telling you all these things about me, and granted, even if you haven't experienced things that I've experienced, just give me stuff back. Like, it doesn't have to be like, oh yeah, when my parents were like this. Like, if your childhood was great and you didn't experience any trauma, that's fine. We can still be friends. Just, we don't need to have some trauma bonding friendship because we're both like, oh, my mom, my dad did this, blah, blah. You know, we can still have a normal friendship even if you hadn't experienced anything. But you got to give me something back. But then, yeah, when you're indulging everything and like, this is what I'm going through, this is what, and then they're like, cool,
yeah, oh my gosh.
And then it's like, this is going to go, like, even if you try and you try, it still will never go anywhere.
No, it's kind of like like you like have to let those people go because that's a one-sided relationship. And one thing is like I'll ask like if I ask somebody a question and they don't ask me something back, that bothers the bejesus out of me. Like
interesting.
What's your favorite color? Like something basic we'll say, and they'll say like pink. Crickets. Like you don't ask me what my favorite color is. I mean, that definitely makes people feel like, well, you don't actually care about me.
Well, and they don't want to build that rapport.
No, like I mean, I guess that's one thing I have going for me is like I've been told that I'm like very good at that, like rapport and like relationship building, and you can't.
Was it interpersonal skills?
Yeah, interpersonal communication
skills.
Yeah,
there we go.
And you can't
I had to take a class in college.
You like can't really learn that either. Like like you can learn how to run groups, you can learn all of like the information and treatments and diagnosing and stuff, but you can't teach somebody how to have a conversation and build relationships with somebody.
Yeah.
So
it's interesting, like, so I don't know if you're dating somebody currently or not, but like knowing what you know now, do you find yourself, because I know you do it, like when I introduce you to new people, and because I word vomit. We will talk about things for hours and hours and hours. We'll find out things.
I'm very, very, very introverted. Social anxiety, very introverted. Okay. Chris is the complete opposite.
Yeah.
So
I'm both.
Yeah, we even each other out. So.
But so I'll be having this really intense conversation, and then you'll say later, oh, that means they might have this, they might have that. And like, so is it
I can't diagnose people, obviously, but I'll kind of come down with diagnoses in my head.
Well, it's like playing a crossword puzzle. You can't help but look at that thing and start to solve certain things. It doesn't mean that you're going to give them a professional diagnosis. No. But I mean, on like
I totally do.
That's what I
do it.
Yeah.
So like I think I told you. So I started the clinical mental health counseling at St. Cloud State, and some things happen where I have to take a break and or go to an online university, but we had started like looking at the DSM-5 and
what's that?
It's the manual with the
diagnostic.
Diagnostic.
It's mostly for insurance, honestly.
To diagnose people and get insurance reimbursements.
Yep.
Oh, okay.
I mean, but yeah, I do that with people that like they talk about like their habits, or like I drink like every weekend, like Thursday to the Sunday. Like I go downtown and like it just blitzed basically. And I'm just like, I do start to be like, I think this person might have kind of a problem. Like, it just automatically happens.
Yeah. It was like when I was learning, like when I took abnormal psychology in college, and you're learning about all the different diagnoses, you start looking at people in your life, and that's how I honestly started to remember the different, like especially personality disorders. I'm like, okay, this person fits in this one. So that's when I took my test. I'm like, okay, yep, what traits did this person have?
Well, and I mean, I think you can't help but when somebody says one thing, it opens up for you to ask the question of like, I don't even know how to say it, but like, so somebody says, ugh, I was at a party and I just sat in a corner and was just counting down the minutes until we got to leave. When you hear stuff like that, I find myself wanting to ask another question because I want, and maybe it's like that confirmation bias type of thinking, is like, I bet if I ask this, they're going to respond this way, and that means that they probably have social anxiety, or you know what I mean? Like, I find myself asking questions like that, not that they know that I'm trying to diagnose them or anything, but
I mean, no, I get that. Like, I mean, I guess I don't ever expect an answer. I'm just more like, but why? Like, I want to know. I'm just curious, naturally curious. It's
learning about how people behave and interact and why they behave the way they do. Trying to understand that.
Yeah. Okay. Yeah. Well, and for me,
because
like it's
you don't behave in that manner, so it's out of that's not your norm. So you're trying to understand why someone would behave in that manner, and you're trying to.
Well, and I always want to help.
Yeah.
Oh.
So I hear.
I know.
Yeah. So I hear certain things, and I go, all right, how can we make that thing better? I tell people, like, I want the thing that you're saying to have the weight that it deserves. Like, if you're going to tell me something, I'm going to respond in a way that lets you know that I'm validating that. You know, I don't want people to tell me traumatic shit and then expect me to like laugh at every single thing that they're saying, because there is trauma bonding, and I've obviously been through rough stuff. But when people tell me things now, I'm like, give that the weight that it deserves. Mm-hmm. Like, if this stuff bothers you and for whatever reason you're telling it to me, maybe on a professional level you should tell it to somebody, and I don't know if you need to dissect it more, or if these are just passive thoughts or whatever, but like, yeah, with every scenario, I want someone to know that their feelings are validated and recognized. And I think everybody's important. And sincerity, to me, is the most important thing in the world. So, like, I sincerely appreciate you being here. I appreciate the profession that you're going into, and the way that you're going about it, too. It's really fucking important. And like Kim was saying, the turnover rate is really high. And
super high.
When I was on the adult mental health unit, Jesus, like almost 90% of the nurses that I saw were floating nurses. So people that just want to be on that unit, very slim. Like, the rotation is just massive. And when you have that, there's people that are there and they're going to do their job, you know, the way that they think it should be done, mm-hmm. and they want to help, but it doesn't mean that they have all of the tools needed.
I think with mental health too and chemical dependency, it's so gray. It's not black and white. So like surgery, I'm going to go into surgery, their appendix burst. This is the treatment that we usually do. There's like, if you look at a diagram, like, well, if this happens and we do this, if this happens, we do this. Major depressive disorder. How can we treat it? Woo! All over the place. What's it going to work for people? It's not. So people that aren't gray thinkers, I think, have a harder time working in that field because they're
of the gray.
Yeah. So it's like, let's be real, the whole entire world's gray. It's not black and white. But there are very much people that live off black and white thinking, and they have, like, that's the kind of roles they need to do. And then there's people that are gray thinkers. And so I think that's why, like, mental health because it's not, I mean, eventually, yeah, you have to restrain people. It can get physically, but it's so emotionally draining that I think a lot of people don't have the coping skills to leave their jobs, go home, and use those skills to kind of decompress. And it's hard because I feel like with those like this field, you bring a lot home that you try not to.
Yeah.
Like, and that's why, again, therapy is so important for people who work in the field.
Well, like
therapy, like coping skills,
exercising. Yes.
Yeah. Like, just doing those self-care things, because otherwise you're going to burn out.
Yeah.
And
and I think it's a high burnout thing because people don't go, like, we can sit there and teach people coping skills, but you need to go home and also do that yourself.
I forget if I've told you this before or not, but one night there was a nurse who was very nice, but I heard her try to give advice to somebody, and this wasn't it, but it was basically to the effect of, like, using essential oils to get over some type of thing. And I sat down with this lady and I was like, does this stuff make sense to you? And she was like, what do you mean? And I was like, well, when you're here, are you looking for like answers? And she was like, yeah, I guess so. Yeah. And so I talked with her for like an hour about how every single person in here is different. This isn't like you were saying, like a surgical unit where you go in and you cut something and then it's fixed. Like, everything is very, very different. And when you say things like the advice that you gave to that other person, you've got to know their personal full scope, because they may take that and then go to a doctor and say, give me all the oil you've got. I'm going to bathe myself in it. Like, people go way off the deep end on stuff. And so any little thing that you say can be huge here. And I remember that nurse being like, yeah, I guess that's why I don't come down here very often. Is
Oh,
Yeah.
it was like, I get it.
Like,
but
she could have just said, like, essential oils, like, they have shown that they can benefit in these areas, but it's not a fix. It's
right,
more
like
of a,
to calm you.
Yeah.
or
well, and
whatever.
there's a like a nonchalant way of being like, do you like peppermint? And if that person's like, yeah, she's, well, I don't know if you know this, but at the nurse's station, they have these little oils that kind of smell like peppermint. And sometimes that's kind of nice, right? Like, there's a passive way of doing that so that it doesn't seem like you're using it to solve an actual diagnosis.
yeah.
Right. I mean, I have heard like people using those as like, I mean, for like if someone's going through flashbacks or panic attacks, to like smell something, because it like distracts you basically.
Yes.
Or like, you know, if you're really anxious, if you go like this and you stand up,
Oh,
it lowers your cortisol levels.
really?
Yep. Or if like you're anxious and you're like sitting like this, if you sit like bigger, and
So big.
like own your space.
Mm-hmm. Oh, okay.
Own your space. So it makes you feel more confident.
Oh, that's interesting.
And it lowers your cortisol levels.
I don't even know what cortisol is.
Adrenaline, anxiety.
Ah, that's really interesting.
Yeah. There's been like studies done on it and stuff.
Wow. Yeah, I mean, there's all kinds of... I've always said, because I have back issues, I don't care what it is that makes me feel better, as long as it makes me feel better. And I mean, I say feel better, like, so that I can do, like, my normal daily tasks. Not, like, feel better like the way the substance can trick you into making you think you feel better. But, I mean, I don't care if it's placebo effect. Whatever, man. Go for it. So if for the people that when it comes to like the essential oil stuff, what's that stuff called? Not pseudoscience.
No. Integrative therapies.
Yeah. Alternative medicine.
That too. Yeah.
Like when people go like, God damn it, I can't think of the word. But anyways, thinking that like
using
mercury
it as an
and,
adjunct.
Like
we're not going to take like... You will probably still need your antidepressant or anxiety medication, but this you can utilize this in situations to see if that can also help. But we're also know that you probably should still be, yeah.
I have like, this is kind of like off topic a little bit, but what are your guys' views on like people that take antidepressants or anxiety medications but are not in therapy?
Well,
this is how I word it to my patients, especially the ones that are hesitant to therapy. You have diabetes, okay?
Mm-hmm.
You need insulin. You have type 1 or your type 2 is unmanageable without insulin. You can pump yourself full of insulin, but if you're not eating healthy, your diabetes is going to continue to get out of control. You can lose toes. I use diabetes a lot because everyone knows about diabetes. So if I say that, then people are like, oh, or you have heart disease. You've had heart attacks. You're on meds to help with your heart. But if you're eating fast food every day and heavy food, the medication's not going to do anything.
Right.
So when you word it in categories like, because the stigma with mental health, we can put you on antidepressants. But if you're not working through what's causing you to be depressed or all these things, the medications, it's going to help, but it's not going to be 100%.
Right. Yeah.
Does that make sense?
I always use like the medications or like a Band-Aid.
Yes.
So, I mean, they're not going to like work to their full effect if you're not in therapy, because you're going to want to rewire and like, you know, like rewire your thought processes as to like why you're having these problems. Yes, you might always be on these medications, but it's going to be important for you to work through it.
Yeah.
Because I know people that have been on medication and they're like, it doesn't even work. I was like, well, that's because it's meant to be with therapy. Because I started therapy before I got on meds.
Well, I mean, that's the preferred way. I mean, people want to know what they're, because when you, like with me, they started me on different medications, and by the time I got out of treatment, I finally was on like a steady dose of certain medications, but there's a lot of trial and error stuff, and that's really because they just, we went to the worst place before therapy or anything. So they're trying to say, how can we stabilize you so that we can then work through these things? So therapy first, medication second is really the best way to go about things. And medication, I meet a lot of people.
Everyone expects the quick fix.
Right.
And like when you 4 to 6 weeks to maybe take an effect.
Well, and like it's a game.
Yeah.
It's a trial and error. They have gene site testing now, which is very helpful.
But unfortunately, that also won't explain what will work best. It's just how you metabolize medication.
Right. I mean, I got it done, and I found out that I was on a medication that like my body didn't metabolize it at all.
Oh, wow. So even if you were on the highest dose, it wasn't going to do anything for you. Yeah. So gene site testing, they do a swab of your cheek. There's different receptors. I'm trying to remember. We used to do this all the time. And then it determines they have like all these medications. It's all like antidepressants, antipsychotics. You can do ADHD and all that. And it categorizes is it green, yellow, red. So red category is you might not be able to metabolize a medication very well, or you need a very high dose or a very low dose. It kind of explains, it gives you a little thing where you can read, okay, this person, medication's not going to work the best with, but if they do a low dose, it might work. And then there's yellow, and then green's like you'll metabolize it fine.
Right.
Well, and I was going to say too, we meet a lot of people who say that they got off medication and they don't ever want to take it again because it wasn't doing anything. And most of the time, those people who are saying that they want to get off the medication or that they've taken themselves off of it, it's because they stopped going to therapy. Because we'll say, I mean, at least me, like I'll say a lot of the times, like, well, how often are you seeing a therapist right now, or what are you doing? And they're like, I'm not doing that because that wasn't working either. And now I'm going to stop taking medication because I don't feel myself. When really what you're saying is, I don't feel like I have control. I'm perceiving medication as like I'm a slave to this medication, which is not the case at all. That medication is there for you to be the most whole version of yourself possible.
Like when they said that, was it like they don't feel like themselves, like they aren't feeling, or because like I've also been on medication where like my baby could have gotten ran over and I wouldn't have cried.
It gives you like that blunt affect where you're like,
yeah, and I just didn't care about anything. Nothing made me like, I didn't feel anything.
But that's the thing, like, that you bring up to somebody.
Well, right? I mean, I got off of it. Like, I think I was only on it for a week, because I knew this is not what I want. Like, I would rather have, it took care of my anxiety, which was beautiful. but the other effects were like not worth it. So I was like, I need to find a way to manage this so I can still feel my feelings.
Yeah.
So did you take yourself, like, did you notify anybody that you were
off
of it?
Like I was just like, I'm getting off this now. Like,
so you told somebody?
Yeah, I'm like, I'm not taking this anymore, and it hadn't been in my system long enough for me to go through withdrawals anyways.
See, and that's different from the people that have been on medications for however many years.
Yeah, they need to tell somebody because like I did have another experience that I was like, this isn't working for me, and we were just gonna see what happens, taking me off of everything, and it was a pretty low dose, but as you can tell, I'm kind of small. So, they were like, yeah, you should be fine. You shouldn't experience any adverse effects, like no withdrawal symptoms. That was not the case. I ended up having to go to the hospital because, I felt like I was literally dying. Like it was the worst. And then paired with that, I wasn't going to do anything, but I was having like thoughts like I could just drive my car off the bridge and it could all be done. Like that's when I was like, oh crap. Like
intrusive thoughts.
Oh my gosh, it was terrible, and I was like crying all the time. And I mean, on the behalf of the provider, I think that was really irresponsible of them, because it's kind of like these are messing with my brain, like, and you just, and I mean, I don't work with that area, so it's not like I knew at that point, like, you shouldn't do that. But again, a learning experience, but I mean, I think that that's a good thing to be aware of, because I never, lots of people don't know that if you just stop taking them, that
especially if you say you're fine, you can stop taking them, you'll be okay. It's like, but if you're not, these are the things that can happen. Like,
right.
That, yeah.
And I didn't even know that. And I didn't have any refills or anything at that point.
Oh.
So, and I'd never been on a medication that had like those kind of effects when you stop taking them. So I think, again, like patient, like informed care before you even get on them. Yeah. It's going to be important. What's it going to look like when you start taking them? What are the side effects? How long until like we probably up your dose? What is it also going to look like if you ever decide to get off of them? That way you can make a more informed and decision on, okay, do I want to do that?
Yeah.
Yeah, it's always really vague.
Right. And that's like a problem. That's a problem. Like, I don't feel like we're informing people.
Like when you're at the pharmacy and they say, do you have any questions about your medication? That should be one of your questions if you're considering taking something, if you're talking with your provider about taking a new medication. When you ask, when the pharmacy asks you that question, ask them, what's it like if I were to decide to go off of these medications? Because I decided on my own to go off of Cymbalta. That's what we were talking about, those brain zaps earlier. It really like felt like an electric like jolt, and it was kind of that feeling when you are dozing off and your head kind of drops.
That's the one that I like took myself off of.
Really?
It was awful. So like she started me at 350 milligrams. Oh my gosh. I was so dizzy. I was so sick.
They started you at 350?
Yeah, because like I was coming off of like, which one? It was one in a similar class medication. Prestige, I think.
Oh, yeah.
Similar class, and she just thought it would be fine. And I had like, that was terrible. She brought me down. Still same side effects. Didn't feel anything. You could have ran over my cat. It was awful.
Yeah. I heard in another one that people have a really, 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 really hard time coming down from is Effexor, is one that people have very bad withdrawals from.
Yeah, I was on that one. Effexor had bad side effects, like in general, and then they put me on, I think Prestige is the predecessor.
Yeah, and that's a newer one.
Like,
I mean,
it's not updated. Yeah.
So, like,
it's it's, I mean, and it's not that providers are like wanting these adverse things to happen to you. They're trying to figure it out, and they have X amount of people that they're seeing throughout the day as well that, that they got to get to. And so they're just like, get back to me. Let me know how this goes.
Well, and we're at such a shortage of psychiatrists that like, I've never seen one in person. It's always been telehealth. And like they've been in like Washington. So, which is where we have family practice doctors that are prescribing antidepressants because you scored XYZ on a PHQ.
Yeah.
I mean, that's where I get my meds now because I can't find
a psychiatrist.
Yeah. Yep. Which is fine because like I'm not adding anything. And
you're just maintaining.
Yeah. And
we should campaign to get sponsored by BetterHelp. Seriously. BetterHelp.com. Have you heard of that?
I have
not. They're
actually.
therapists. They're not psychiatrists. So we're talking about psychiatry.
No, I know, but then they can help you get in touch with.
They can refer you, I believe.
Yep.
Yeah.
But man, you can be on a wait list for psychiatrists.
I was on a wait list for a year.
No.
For a year. Yeah.
So imagine, primary providers will prescribe like antidepressants, anti-anxiety. Imagine these people with schizophrenia and the ones that are on hefty doses of antipsychotics, like Clozaril. You have to do blood work every so many, with that medication, or Depakote, stuff like that, where you
do people still get lithium?
Yes, absolutely. So lithium levels. So with these medications, you need blood draws. Primary providers, you're going to go to them and be like, hey, I need, I was on this medication, I need a refill. They're going to say, hell no, because it's a scary medication because you have to monitor it so closely. Right. But I'll put a referral in for psychiatry. You might get in a year. You're probably going to go to the hospital 4 or 5 times before you even get into a psychiatrist. So good luck.
Yeah.
Yeah.
Wow.
It's a very broken system. And if your mental health is very poor, you have these diagnoses, you do any criminal activity, we're going to throw you in a jail cell where you're not getting any mental health. We're still not going to give you meds. And now we're having this revolving cycle. And now you're a felon. Good luck getting out of jail and anything good happening for you.
Wow. Yeah.
We can go on for hours. I don't want to talk about it. I got upset last night about stuff like this. So
yeah, that's really, I had no idea that there was a waiting list for that stuff, because I say all the time on here, like, go set up an appointment, but I didn't know that
therapists are a little easier. I mean, they can be a couple weeks out,
right?
Maybe a month, but not like a year is.
Well, I'm saying, so what I should be saying is, if you're considering it, set up an appointment with a therapist and get the ball rolling. And if you don't want to do the psychiatry thing, you don't
always
end up doing it.
Yeah.
But if the waiting time is that fucking hard right now, then definitely sooner than later.
I think it'll always be like that.
Yeah, it's not going to get any better. I mean, it's such a shortage, and I mean, then you've got psychiatry and like therapists they work together, but they also butt heads because you work for big pharma. What's your agenda?
Oh, wow.
Whereas the therapist will spend an hour, 30 minutes. Usually it's an hour with a client, and psychiatry 10 minutes med check appointment. Come in. How are your meds doing? Oh, you're good. Any side effects? No. Okay, I'll refill your meds. And this is another thing that I work in the medical field, obviously, but it's a business.
Oh yeah, no,
especially primary care and all those. How many patients can you see in an hour? Because you're going to get reimbursed on all those patients, and you get paid based on how many patients you can see.
And I don't think they do this anymore because, like a lawsuit or something. But back a while back, they used to get there would be like conventions for like psychiatrists, and you'd get kickbacks and free trips, and if you push these meds, which is just so unethical on so many levels.
Yeah.
But I mean, they still work for big pharma, and they still get reimbursed for what they do prescribe, so it makes sense that they only
I do want to say though, on behalf of where I worked, we could not accept any gifts. We couldn't accept any free meals, because they would come to you and be like, I want to tell you about this new medication we have. We will provide you lunch. Our organization's like, absolutely not. We're not taking free gifts. We're not taking free food. We're not taking anything like that. And I really did stop seeing those people coming in to my outpatient clinic.
Wow. Yeah, I've seen them too. And it's just the agendas that are behind these is just it's ridiculous and it's unethical. I'm for medication 100%. Paired with like therapy, and if it works for you. It's just I do worry about like the agendas of the pharmaceutical companies, and then of course I never had a good experience personally with any psychiatrists. I always just felt like they were pushing me through.
I think, do you remember when I told you about this, the guy that he was because I had such bad anxiety attacks, because I suppressed it with substance for so long. I forgot that I still had them. So at the treatment facility, there's a psychiatrist who was like, I want to do a meditation practice with you. And he's reading through the thing, and he said, breathe in, breathe out. Are your palms open? Good. And I was like, I can tell that it says good on your piece of paper. That's so disingenuous. So when we were done with the little practice, I said, does it say good on your sheet? He was like, yeah.
At least he admitted it.
Yeah.
But it's like, and even though he admitted that, he was like very like, all right, you got to get out of here. I got the next person. But yeah, with the counselors and the therapists, they do want to get to know you better.
I thankfully in my area that I work with amazing psychiatrists. Like the one you had on the unit is one of my favorite people.
Yeah,
because the way, don't say his name on here, but yeah,
that was close.
Yeah, I know. He is one of the kindest, most understanding people I have ever met, and the way he just treats everybody with respect. Like he loves mental health. But then there are people, which the one that you had the first time you were on the unit, who dressed up and all that.
Yeah, we can talk about him because he's in jail, right?
What now?
I don't know if he's in jail. I don't want to talk poorly about anyone that I've had. I guess I know.
He was a predator.
Okay, I need to know now.
Can you just bleep this out, please?
Yeah, his name's Dr. Meany.
Dr. Gavin Meany.
Which is hilarious that was
he
his
was
last
a
name.
Psychiatrist when Chris was on the unit. Super spiffed up suit. The provider I'm talking about that works on the unit now, he wears scrubs. He just walks in. He wants you to know. I don't,
Yeah.
Like they made him work from home during when COVID was bad, and he didn't want to. He's like, I don't want to talk to my patients through a screen. I want to be there in person. Right. And so there was a lot of disarray. But you gotta also bleep that out.
I love that though, like that he wears scrubs, because like that's another thing is when professionals, counselors, therapists, they dress up, that's intimidating.
Yeah. So you can tell.
Yeah.
So
okay.
Tell her about Meany, and then I'll tell you what happened.
Okay.
Because I'll pull up we found out about this because he was still one of our on-call psychiatrists at the time.
Yeah. So he had 3-piece suit, everything super pristine, clean, and he's talking to me, and I was like, why is it that you dress the way that you do? Because you realize that like you're separating yourself from people, and they're automatically going to view you differently. And he was like, I want them to view me differently. I don't want to be anybody's friend here. And I was like, well, do you want to like be intimidating? He was like, no, but I did read that. And I forget what he spat out about some article that showed that people view you as a professional if you dress as a professional. And I was like, but everybody else is wearing scrubs, and we know that we can go to them for help.
Right.
When you look the way that you do, people don't feel like they can come to you for help just on a visual level. And he just basically told me that that's kind of how he wants it. He wants to have that degree of separation.
Barrier?
Yeah. And
what happened after that? What happened the next day?
Oh, yeah. He showed up and he had taken the jacket and the vest off, but he still kept the slack.
I thought you said he was in a polo and slacks.
No, he had, button up.
Oh.
But he had changed a pretty big aspect of the way that he dressed. Because like I said, you could tell it was like an expensive suit, and he gave some ground, but not enough, at least in my opinion. And that was back when I had like really self-righteous tendencies. I was like thinking that I could do his job better than than he could.
So a year ago, a year and a month, Apple Valley psychiatrist pleads guilty to criminal sexual conduct involving a patient. He was treating the victim as a patient in his role. I think it was for a long time too. This patient was abused over the past 5 years while receiving therapy and psychiatric services from him. Multiple acts of sexual touching, penetration that occurred in his office. Yeah.
So the first thing I learned on day 1 of ethics is if you don't take anything else away from this class, remember you do not sleep with your patients.
Yeah. Big one. Don't do that. When I saw that, I was like, okay, yeah, of course.
Well, and actually, to bring it back to addiction, cross addiction is a huge thing, and people can get overly sexual when they're going through these things. And when it comes to treatment, like outpatient stuff and groups, there a lot of times will be people that try to hook up in these groups, and it's like you're there for the wrong reason. Then you need to take that part. That shouldn't even be part of the equation. Like, you're there to get better. So not only on a professional level, like, obviously you should have that degree of separation, but when you're getting better too, don't like mistake or don't misconstrue you're getting better for meaning now I should get in a relationship. Like, most counselors say that you should wait a year.
Yeah, I was gonna say we say like a year, or like gambling. Yeah. Like, oh my gosh, just there's like gambling, like porn, sex, like, you know,
cigarettes.
Like more. Yeah, I mean, then there is like a correlation with because at the treatment center I'm at, they were one of the last ones to stop letting clients go out for smoke breaks. That you are more likely to stay sober if you if you stop all substances.
Whereas somebody picked up smoking at treatment,
which is double bad because I don't smoke.
Well, now that's why he keeps popping gum. He's on nicotine gum right now.
Okay. I was like, what?
Well, but the shitty thing was the biggest breakthroughs I had were on these smoke breaks. So my brain automatically associated these positive things. That's when your moments of clarity are going to be, because you can't be indoors. So you're removing yourself from your normal environment, and you're having to speculate and think about life. And when I did that, my brain was like, oh, dude, remember how when we smoked cigarettes, we found out this massive thing about sobriety? And it's like ironic to think I was sober from one thing and like finding out more about these things, but I was replacing it. Yep.
Yeah.
Super common.
Yeah.
Yeah. Mm-hmm. But yeah, that's a really good thing too. I mean, they had smoking pits everywhere, but they also cater to like there's a lot of money. There's a lot of money at that place, and some of the meetings that you would have were also like pitch meetings.
Oh.
Which can seem very disingenuous. And like, there's a lady that works there that flies in from New York and works 3 days and then goes back. So that's how much money you're making, that you can only work 3 days a week.
Face just probably
so. Yeah, there's a lot of money that floats in and out of there, and
I think that was a psychiatric provider again, and with the shortage. No,
not a psychiatric provider.
All right, never mind then. Take that back.
Dang,
just a counselor.
Really?
You know where you need to go.
No kidding. Oh my gracious.
Yeah,
if you go there, there's nothing over there. If you want to live in like a bodung town, though, there's literally
really.
But she was just very versed in the 12-step program. They call Alcoholics Anonymous book the big book.
Mm-hmm.
And she was just very well versed in that. She was basically like a theologian, but for Alcoholics Anonymous.
Do you like AA or NA?
NA.
Okay, I was gonna say, like, I feel like AA is kind of it's like a little
Catholic
outdated
school.
A little bit.
Yes.
It's like the older people tend to like that one, but the population that I work with right now, like, they're like, do we have to do AA? Like, let's do the NA.
Yes.
Which the stories in there are better in my opinion too.
Mm-hmm. So, well, a lot of reason why like the treatment facilities that focus on Alcoholics Anonymous, like why people seem to not be as engaged, is because for people that are in there for narcotics or anything else that's not alcohol, they can't relate to the other person that's sharing. Like when it's their turn, it's like, and then they feel like they're being judged when they share their thing, because these guys who just drank too much. And that's the other weird thing, is like they say, well, all you did was drink? Dude, I was shooting up heroin behind a dumpster. Like, we're not the same.
I was going to say there's also a separation in treatment if you're an alcoholic versus if you use like meth and heroin, because one's legal.
Mm-hmm.
I was like, no. You're not in here because like You just went to the bar like last weekend. Like, you know what I mean? Like,
yeah.
I mean, it's the same. It's just a different substance, and one happens to be legal.
And your dealer's literally on every corner and everywhere you go.
Right.
Yeah. If anything, you should be more scared because your thing is fucking everywhere. And people like when somebody is recovered from meth or heroin, there's nobody casually like, oh, you're not going to be weird if I shoot up right now, are you?
Oh my goodness.
But like people with alcoholics are like, do you mind if I have a drink right now? Is that going to be okay? Like,
well, right. Or I mean, it's so like, oh, let's go grab a drink. It's so casual. It's like ice cream. You know what I mean? Like,
well, they've
but
integrated
if you were telling your friend like, well, let's just go shoot up some meth, people would be like, what is wrong with you? Yeah.
So I mean, there's also a separation in treatment there. Like, I saw a lot of like the alcoholics kind of like had a little group, and you know, because they couldn't relate to what it's like to shoot up. You know?
Yeah, drug use is associated with criminals. And
well, yeah. I mean, it's, you know, a lot of times they have been in jail or prison, but so have these alcoholics because DUIs up the wazoo, you know.
I was just gonna say, if you have gotten a DUI or DWI, guess what? You're just as much a criminal as these other people. It's the same fucking thing.
Yeah. No, I agree. I mean, I have had to
I fidget a lot. This is my anxiety. I just fidget.
Okay, I kind of picked up that you're probably like a little anxious. Yeah. But, sorry. Oh God, I forgot what I was gonna say. Oh, that they do kind of like separate themselves from each other, and I've had to kind of basically during group like tell them to knock it off. Like, y'all aren't better than these people.
Yeah.
You didn't get here for good behavior. Okay.
Yeah.
I could go on and on. This has been fucking great. But what advice do you have for either people who actually, you know what? I'm going to cater it to people who have a loved one or a family member who is affected by addiction right now. What advice would you have for them as to like what they can do or how they can make this other person feel more comfortable?
And on top of that, like after that answer, people that are questioning if they think they have a problem, like what advice would you tell them? Like what steps would you tell them to take?
I mean, I think that for the first question, to support that individual that has an addiction problem, just be supportive, don't enable, give them like, you know, if they're receptive to it, like information on like maybe some pamphlets. Here's some pamphlets like where you can find help. What about NA, AA? They have to make up their own mind on like what they're gonna do. That's not on you. You can give them the information and they have to do what they will with it because they have to want it. I mean, I wouldn't say close the door entirely. Love them from afar, depending on, you know, it's going to depend on everybody's situation. But, I mean, obviously, if they reach out and be like, I need you to, like, help me get into treatment or whatever, like, I mean, help them, like, be receptive to that. And again, I don't know everyone's dynamics because everyone's different.
Sure.
And then what was the second question?
If someone's questioning if they may have a problem, like what steps would you suggest taking?
I mean, you can always like get a therapist. They would be able to help you or refer you to treatment if it's, you know, severe enough. Otherwise, if you really do think you can call any treatment center and be like, I would really like to get in for Rule 25.
Oh, okay. I mean,
you'd pay out of pocket. More than likely your insurance would cover some of it. It just, you know, it depends, but and just to see where you're at, but be honest about it. If you're going to go in and do a Rule 25, you need to be honest about everything because that will determine like where you get placed or if you really do think you've got a problem, you know. I mean, I've seen people come in that do like they've got a problem, but it's it's almost like they caught it soon enough where they don't need high intensive inpatient.
Oh, sure.
It's like they need coping skills on like, and therapy and that kind of thing. Everyone's at a different level, and I think that just meeting yourself like where you are right now is really important. So
I always flub this, but I'm trying to think of like websites or resources that people can go to try and get help. Obviously, I didn't mean to shit talk Alcoholics Anonymous, but obviously, I think it's just AA.org. You can go there, and
I mean, and you
Smart
can
Recovery is one too.
And you can like Google it. Like they've got like NA and AA meetings now online. I mean, they're more prevalent due to COVID, but they were always there because of the younger generation. I mean, so like probably my age and younger, we're busy. Okay. Like, I mean, I'm going to let, if I can hop on a Zoom meeting or like just chat, like that's helpful. Yeah. Granted, it's not the same as connecting with people, but it's something.
Yeah.
And maybe they're scared, which is really common. Don't be afraid to ask like a friend or a family member to go with you. Like I've went to NA meetings because somebody was scared to go alone. Just like having that support system. Don't feel like you're in it alone, because I have seen like people that feel like they can manage it by themselves, and you can't. Like you have to want the help, but it's okay to ask for help and support. And
Well, awesome. Thank you so much again for being here and doing this.
Thanks for having me. It was really fun.
Yeah, I enjoyed it. As always, subscribe, and if you'd like to be featured, you're more than welcome to call in. If you're potentially going through addiction right now and maybe haven't said these things out loud and would like an anonymous platform to kind of just bounce things off of, we're non-judgmental, and sometimes those stories help other people kind of figure out where they're at as well. Or if a loved one is dealing with things, or if you're someone in recovery who would like to share their story, you can absolutely reach out. And you don't have to be here in person or share your name or any information about your personal life. You can remain anonymous in that regard. Kim Duke, anything you want to add?
I got nothing.
All right, well, I love you.
Love you.
And you're awesome, and I like the hoodie that you're wearing.
Oh my gosh, you guys are so cute.
I'm so excited. So excited.
Alrighty. You want to do it at the same time again?
Sure. And with that, we will pass. Yeah, nailed it.